Today's subject is going to be on the prostate gland. Now, the prostate is what some people will call it is prostate. Some people will call it prostrate. And both of them are utilized and used. So when we say prostate or prostrate, it will mean the same thing. So where in the world is the prostate gland and what does it do? You know, it's interesting. Unless you have a problem, you really don't know much about it. Okay, if a patient has diabetes, he's going to be an expert on diabetes. If he has cancer, he's going to be an expert on cancer. Prostate issues, of course, only affect the men as far as physically, and so most men are different than women. They will kind of not go to the doctor until something doesn't work, or they're hurting too much they can't do their job. Most of my prostate patients have been referred in by their wives. So the wives make the appointments for the husband because he just doesn't go see the doctor. Prostates are terribly important. It's amazing what can be done for a prostate problem without drugs and without surgery. But first off, what is a prostate gland? Well, there's a urinary bladder here. The prostate is a little gland like the size of an almond that sits underneath the bladder. The kidney sets up here, and it runs a tube from the kidney over to the bladder. So blood goes into the kidney, which sits higher, and then this tube runs and separates the blood, and the urine comes to this tank, and the blood then recircles back through the body. Okay? So then there's a urethra and a ureter, and so the tube that comes down here takes the urine out of the bladder, and it has to run down. The prostate is underneath this, and it has to run down by that prostate gland. So what happens is a lot of symptoms. Number one, when the kidneys dump the urine into the bladder, okay, then there's a muscle down here, and this muscle then, when it gets a certain amount of pressure on it, it will then release and let the urine flow. So it tells the body it's time to release this urine, okay? Well, what happens with a prostate gland is it has a tendency over years to get larger. And that increased size begins to create different types of symptoms, okay? So as this begins to get bigger, this gland, or this muscle here, begins to swell and get more sensitive. So now this amount of urine, which was telling you it was time to go urinate, now it takes this amount of urine to make you go, say, I think I need to urinate. The problem with this prostate gland is it continues to swell over years. The youngest person I've ever had was 16 years old. Okay, prostates can be injured bicycling, farmers with tractors, all kinds of different things, because that sits right down at the bottom of the pelvis. And also, bowels can aggravate the prostate, because the bowels are there and it goes right across and it'll irritate that prostate gland, and that has a tendency. So constipation is one major factor in aggravating prostate issues. So now this gets swollen, and we talked about in other videos how swelling is what creates pain. And pain is only one symptom of a prostate issue. Number one, if this thing continues to swell, then it takes less and less urine to keep giving you the signal that it's time to go urinate. As it continues to do that, frequency of urination is a major problem. Okay, and men can't figure out why they have to go. It's going to hurry to get there, and then when they get there, they can't hardly start the stream, and it doesn't want to continue very long because there actually isn't enough urine in that tank like it used to be up here. So they go into their doctor eventually, and he diagnoses it as benign prostatic hypertrophy, or BPH. Hypertrophy means an enlargement. So benign means it's non-cancerous. So you have to take blood tests to kind of get a value of that. Okay? And that blood test would be called the PSA. That stands for Prostatic-Specific Antigen. and there are normals depending upon the age of the patient. So at this stage, you take these blood tests, and then what you do is you go in the rectal area, and I will just check that prostate out because it's going to get bigger and bigger and bigger. If you don't do that, you're not going to know. And long-term swelling can cause tumors, cysts, all kinds of abnormal things too. If you don't go in and check that out, you're going to miss it. But when the symptoms continually get worse and worse and worse, you finally have to go in, because eventually it will swell to where a lot of times it will actually stop the urination. Then you're in trouble. Then you go in and you have to have a catheter put in just to get the urine off of that bladder. So the object of this is to always catch benign prostatic hypertrophy before it becomes a malignant issue. So that's earlier. And in what age? It doesn't happen generally in younger people too much unless it is an injury. But from anyone over 40, you're going to see very, very constant, consistent symptoms. So in a prostate issue, long-term swelling causes pain, but it also can cause cancer. And that's what our problem is here, is long-term swelling finally will break the tissues down and we end up in prostate cancer. So as a chiropractic physician, can we work with these prostates? We can take these prostates, we can do prostate massages, we can bring the swelling down, we can change diet, we can use nutritional products to do this. It's a very, very positive thing, and it's very fast or responsive to care. Instead of going in and do what they call a TUR, that stands for Transurethral Resection, that's the old Roto-Rooter. That goes in and tears the tissue up to make that hole bigger so more urine will come. Never fixes anything. I had a patient in that he had 6 of those. Okay? Then they wait until they can go in and do biopsies on these. And they'll go in and do 6 to 12 biopsies on these. And then they will check to see if there is any cancer cells on it. Okay? So our objective in our session today is we want lots of benign prostatic hypertrophy patients. Once it becomes a cancerous issue, then that's beyond what I would want to deal with. So our objective here is to educate people, what in the world does the prostate do? There's other factors. This has to do with reproduction, but the main reason for a prostate is the testicles produce sperm and brings it and goes down in through, the sperm goes down through that prostate, and what it does is it coats the sperm with a thick white substance, and then what happens is when the sperm hits the vagina, if we didn't have that prostate there, that acid level would kill the sperm. So non-reproduction would happen if you don't have the prostate gland. So without a prostate gland, you couldn't have children. Okay? That's the purpose of the prostate gland. And so hormones are involved, diet's involved, all kinds of things. We can cover more of this on other issues. You can have, if we have information in the office on that, you can call the office if you have questions. But this gives you a basic understanding of what it is. So if you have any other questions, don't hesitate to give us a call. We'd be happy to answer them for you.